terms of racism and how it plays out in healthcare, I think that there are numerous studies you can refer to. So those of us who are healthcare leaders always talk about the Tuskegee experiment. In the, several centuries ago, we talked about, not even several centuries ago, excuse me, several decades ago, talked about using African American men and not treating the syphilis that they had to see what the effects would be on their body. So when you talk about it coming from an African American perspective, there's a distrust for healthcare, right? So if you talk about the trust of the relationship you need to have with your healthcare provider, it's not there. If they don't look like you, if they don't respect you, if you feel like you're not being seen, then do you actually receive healthcare? Do you want to go seek the healthcare even though you may need it? So when I think about racism and healthcare, and what does that mean? It means that we can't always assume that individuals are going to come to us, but we need to go to them, right? We need to meet them where they are. And you asked me for examples of that. I think one great example of that is G's Barbershop, right? Where he has a health clinic inside the barbershop. That's important. Why is that important? Because African American men are going to get their hair cut, right? If you're there and you're having a conversation with the person who's cutting your hair, and we can talk to them, or they can talk to them about some health issues, right? Whether it's high blood pressure or smoking cessation or whatever it is, and then literally in the same space that they feel comfortable in, they have services. That's important. We also think about it in terms of school, right? If you're in school and maybe you don't have transportation or you don't have a relationship with a physician, a primary care physician, can you still seek services? So from a Froedtert Health perspective, Froedtert Hospital perspective, we have partnerships in schools with community organizations to meet our constituents, our clients, where they are. Now, I purposely didn't say patients, right? Because when we talk about health, you're a patient once you're an inpatient, once you're inside our facilities, but you're our consumer otherwise. You're a consumer of health. And so how do we meet you where you are and provide those services there?